Hey, what's going on, everybody? This is Dr. Roch Herold. I am so excited today because we are going to be continuing our Dare Champion interviews with none other than this phenomenal woman right here. And just real quick before I introduce her, the whole purpose of these Dare Champion videos is really to highlight features of the book and to highlight great overarching concepts of the book, Dare to Live Well, the ultimate guide to building generational health. And I'm so excited because it's amazing to kind of talk across different disciplines and different industries. But right now, this episode, we're actually going to stay within the topics of healthcare and beyond, right? And we're going to talk to the wonderful, amazing, phenomenal nurse practitioner, Eboni Mccoy. She was the previous medical director of MSI Integrative Healthcare, which is my company, and now she is the current founder and owner of State of the Body LLC. And Eboni, I'm so happy for you to be here with me.
I'm so happy to be here.
Oh
so happy
my
to be
goodness!
Here.
How are you? How are you doing right now?
Well, I'm doing well. This is an exciting time for you.
Yeah.
An exciting time for MSI. I mean, I've been able to read some of the book.
Awesome.
Yes, I got a privilege to read some of it, and so it is just igniting.
Yeah.
And it's freedom.
Yeah. That's what it's about.
Yeah.
That's what it's about, like freedom in healthcare. I think there's so much. I mean, you and I, we've spoken on many occasions, but it's like one of the burdens, not burdens, but just passions with me writing the book is really just letting people know that they have freedom in healthcare.
Yes.
And as we're going to get into today, there's so many things, whether known or unknown, that are sometimes, for whatever reason, people feel like they're tied down to this discipline or this provider or this, insurance or whatever. And, healthcare choices become so limited,
Yes.
right? And with that, it's like people don't have the freedom to, make their own healthcare decisions and know that they're in charge of their own bodies.
Yep.
So that's the whole dare, dare to live well is really, I'm pushing people into that freedom, right? Because it's there, but so many people, I feel like when working with patients day in and day out, they just don't realize that they have it. So, let's go back before we go forward.
Okay.
What experiences in your childhood, and it could be positive or negative, but what experiences in your childhood led you to saying, hey, I want to be Nurse Eboni, the woman that I am today, the health professional that I am today? In the book, I always talk about, the decisions that we make, other people are watching, and other people, we can impact people either negatively or positively. So were there either some, instances in your life that said, man, you know what, I want to get into healthcare, I want to be a nurse? Like, how did you even get into healthcare?
So that's a really good question, and I was kind of mentally preparing for this.
You knew that was going to be the first.
Yes, and I said, okay, let me get that together. But how it came about, actually, I was in a dance group.
Okay.
When I was younger.
All right.
And my dance teacher's mother was a nurse. And I saw her leaving out. I was spending the night over there, and it was snowing. And she had this fur coat on, and she was leaving out. I said, well, where is she going?
Yeah.
And, she's going to work. I said, well, what does she do?
Yeah.
And they're like, she's a nurse. I said, the fur coat, all that out there. That's what I need to do. But on a serious note, my grandmother and my cousin, my oldest cousin, have and had, because my grandmother has passed, diabetes.
Yes.
And so I said, well, I want to learn everything that I can about diabetes so that I can help them be well.
Wow.
And so went to nursing school. When I got out of nursing school, my first job was on a diabetes renal unit.
Wow.
So I took it very seriously because I wanted to help my family. So that's the reason, is to help my family,
That's
healthy.
amazing. And I mean, and of course, when you first started, you started into, I guess it was more gerontology, correct?
So, as a nurse practitioner, you start out as a registered nurse,
Okay.
4 years of school.
Okay.
And so I worked in the hospital, but you can work in any setting, the
Yeah.
school setting, community, public health, but you have to have a 4-year degree.
Yeah.
And then afterwards, if you want to become a nurse practitioner, you go on to get a 2-year degree, which allows you to have a master's and practice as a nurse practitioner. So I didn't start out necessarily in gerontology. I would take care of the entire lifespan.
Yeah.
Primarily adults on a medical surgical unit.
Okay.
Yeah.
Okay. And I mean, of course, and we've had this conversation too. In the book, I talk about, even, disclaimer, there are, thousands upon thousands of amazing health practitioners, such like you and I, and many of our colleagues, right?
Yes.
But however, I feel like the system of healthcare, and that's how I actually start the book off, and I kind of make the case.
Yeah.
If people, let's say, Dr. Herold, he's going off on the deep end, I just make the case that, okay, if you look at all the industrialized nations, we are spending the most, per capita on healthcare, and we have the worst, results in terms of, a quality of life,
Yep.
in terms of preventable diseases, in terms of, many of the different challenges that we have in healthcare that we could talk about today. What are some of the challenges that you saw when you first, you just came in, you were inspired by, like grandma, by the nurse with the fur coat, and now you're in the system.
Yep.
So, and it's almost like you're taking a fish and, putting it in a new pond, right? How was that experience like, and how was your eyes opened to what's really going on in healthcare?
Yeah. My eyes were open to healthcare once I went to nurse practitioner school. So I went to UNC, Chapel Hill.
Okay.
And I wanted to prevent everybody from getting sick. And I wanted to start in colleges. Like I wanted to be an occupational health nurse practitioner in the college setting because I'm like, okay, these kids are fairly healthy.
Yeah.
I can start to show them what it is that they need to do to stay healthy.
Awesome.
This is where I want to go.
Awesome.
Okay. When we started clinical, there wasn't clinical opportunities to get in there and do that.
Yeah.
And then I'm like, okay, well, I'll do primary care. Primary care.
Yeah.
So I'm like, okay, if it's primary, then we're preventing something,
There you go.
right?
Yeah.
But once I got into primary care, I saw, oh, this is secondary, tertiary care. I'm not curing diabetes. I'm managing it.
Wow.
I'm not curing asthma.
Yeah.
I'm managing
Managing
it.
it. Wow.
I'm not curing COPD. I'm just managing it. And so people are just seeing you for check-ins to see if their disease process is tamed or is it inflamed.
Wow.
You understand what I'm saying?
Yeah,
And
yeah.
I was like,
Wow.
but I didn't like you're talking about in the book. As a healthcare provider, I didn't even know that there were other options.
That's what it is.
That's what it is.
And in that first chapter, I talk about the healthcare system, the way it's designed. It's not really a healthcare system where health and health promotion and
Right.
prevention is at the forefront. It's really more of a sick care system
That's
if you think
it.
about it. We're managing sickness when you really think about it. And that's that freedom that we're talking about
Yeah.
because people need to know that, you're a healthcare, and if you have access to it, and we can get into that, it's more than just, getting access to a doctor just to find out how much longer you have to live.
That's it.
Right? Like
Right.
there has to be more of a, one a desire to live well,
Yep.
right? Not just because people are living longer.
They are.
And that's why I love that the fact that I'm a chiropractor and when I'm talking to people, I'm letting them know, like, look, okay, you've got some early disc degeneration, but you're only, 28, 32. You played, I don't know, lacrosse, soccer, you did gymnastics, you danced, right? And you had fun, but you're starting to see some early signs. And what I always tell people is that, okay, the fact that you have an MRI and it's showing that, don't just wait until it gets worse to do something about it. There's so many things. There's a whole table before you of things that you can do to prevent it from getting worse and to also make sure that you can ensure a good quality of life.
Yep.
Right?
Yep.
And that's, I think, where you were getting with the things that you were seeing. I mean, it's amazing that in me even looking to integrate my office, and we can talk about integrative healthcare,
Yeah.
I was looking for a nurse practitioner, and it was so refreshing to find somebody like you who is a medical practitioner, but yet also was thinking holistically as well. It was very, very hard to do that. It took me at least 3 to 4 years to find somebody that had that. Explain what that process was like, because you were managing sickness.
Right.
So where did you start to make the shift to say, you know what, I want to do something different?
Yeah. Well, like you said, it was always in me.
Yeah.
I've always been. It starts with you,
Yeah.
like you mentioned at the beginning of the book. You had mentioned being sickly, and it's like, okay, I've got to take charge of my health. You were young at that point. So for me, it's kind of like, I need to take charge of my health as well. I struggled with high cholesterol young, and it was just kind of like, I don't want to be on medication, so what do I need to start doing? So if I need to go on walks, if I need to exercise every day, whatever I need to do, change my diet, that's what I'm going to do.
Amazing.
So I think it starts within you. I also think that in formal education, you went to chiropractic school, so the education is a little different, but my training is medical, so that's what they teach us in, to prescribe medications, to send to physical therapy, surgery, those types of things. But when you see that that's not really effective, it's like, okay, what am I doing with my license? How am I really helping folks?
Yeah.
You know what I mean? And so when I got out of nurse practitioner school, I couldn't find a job in primary care, so I ended up working in cardiology. So I did cardiology and vascular. So people who had peripheral vascular disease, venous disease, those types of things. And I was in there no more than 3 to 6 months, and I was like, I don't want to do this.
Well, did you see people getting better?
No.
Because that's what that's one of the biggest changes. When one of the first nurse practitioners was working with us, she made this statement that was profound, because in my office, we're used to getting people from one state to another. And she was like, man, it's so refreshing. And this was somebody that was practicing for maybe like 10 plus years in that, family care. And she just said, it's amazing to see people get better.
Yeah.
And this was a health practitioner saying that. But I said, what do you mean? Yeah, what do you mean? It's amazing to see, because she was just so because in that healthcare system where you're managing sickness, what people have to understand is that every sickness has a progressive, nature, which means it's going to get worse.
It is.
Diabetes is not, you can't just chance your healthcare. You have to, take charge of it, because things are going to get worse. That disc degeneration of somebody in their 20s and 30s, if they do nothing about it, it's going to get worse. The diabetes, the hypertension, it's going to get worse. The
cardiovascular disease. So is
that what you saw? Is that you saw people kind of worse, like getting,
or not wanting to do anything about it at all? They could have an event. They could have a cardiac event. They could have a stroke, and it's like, I don't want to be on medication. And so it's kind of like, well, if you don't want to be on medication, I understand, but what's the other option?
What's the other option? Yeah.
I had a client yesterday. She wanted to stop chiropractic care, because of the financial component.
Yeah.
And so I said, well, as a provider, I can't give you the okay to stop chiropractic care.
Yeah.
I said, if you're going to stop, what's the plan?
Yeah.
And then when I broke it down like that, when you have those candid conversations with your patients, first of all, they know that you care, and then it makes them think.
Yeah.
Like, I really don't have a plan. Your hip is already bothering you.
Yeah. Yeah.
What are we gonna do?
Exactly.
And here's that. And so then it was like, okay, well, I'll continue. When you really look at that, you don't want to use a cane, you don't want to use a walker, you don't want to be in a wheelchair.
Yeah.
We're giving you a plan that I said, don't do surgery.
Yeah.
You're not a surgical candidate right now.
Yeah.
I know you have pain, but your body can do what it needs to do to heal itself, and you have to invest in that. And I wanted to make a point that you made in the book that I really, really just loved. The reason you said people get sicker and sicker and sicker. And I think there has to be a mindset shift, because people think, well, if I'm sick, somebody's just going to take care of me. And that's what the model presents. Oh, my kids will take care of me. My grandkids will take care of me.
Wow.
So remember when you said the two, dare to live well, the two, how it impacts somebody else? people don't take the health seriously because they're not worrying about how it impacts somebody else.
Woo. Wow.
So if my mom is sick and I'm like, Mom, you need to eat this. You need to do this. Because if something happens, who's turning you in the bed? Me. Who's got to take off of work?
Yeah.
Have you set up financial things in place so that if I do take off of work, I'm okay to make sure you get the best care that you get?
Wow.
No.
Wow.
So don't be mad with me when I tell you you got to come down a couple of pounds.
Yeah.
Don't be mad when I tell you you need to continue chiropractic care. Don't be mad when I tell you you need these knee injections.
Yeah. Yeah. Yeah.
When you said that in the book, I was like, that's it.
That's
People need to know how their health impacts someone else.
Yeah. And that's it. And that's why I spoke about it being generational, because, you know, your decisions today affect everybody else tomorrow.
That's it.
Your decisions today will affect everybody else tomorrow, whether it's, you know, and it's funny because I spoke to Dr. Gabby Saint-Leger just previously in another Dare Champion interview, and she's in education, but she spoke about being a caregiver for her mom and the toll that had on her, and that was part of her health journey, you know, and it's her mom, so of course she's, you know, we're going to move heaven and earth, but, you know, is that what we're going to do for our kids now that we know better, and now that we know, you know, the difference? So, and not just, you know, kids, but the people around us and our friends, and how much more of an impact will we have when we make positive decisions and we see other people living healthier because of that? Like Joyce's life, my wife Joyce's life has been impacted just by your walk, by the things that you do, and you've been looking at a naturopath, and you've been doing more holistic things and looking at IV nutrition, and Joyce is doing that. So that impact right there is not just generational from a vertical standpoint, but generational from the people that we're in touch with every day. Yeah. And that's what it's about.
Can I tell you guys the impact that y'all have, the chiropractors?
Yeah.
Because, you know, outside of you, I work, you know, in a chiropractic office currently. And because of when I left the cardiovascular office, I said, I'm not taking another job that's not going to help people get well. Wow. So I went back to doing regular nursing, working in a spine and pain clinic.
Lord.
And I said, I'm not going to do another nurse practitioner job unless I'm helping people. So that's how I got into regenerative medicine.
Yeah.
Okay. So I wanted to do functional medicine. That's where you get to the root of whatever disease process someone has and you heal them from.
Yes. From the inside out.
From the inside out.
Using nutrition.
All supplements, all different kinds of things. And so at the time, I had just graduated from nurse practitioner school. That was extra money. You know, I'm like, I gotta make some money right now, you know? But had I known better, I should have gone, but I'm glad that I did it because I got in a region, connected with some really good people who were in functional medicine, who really showed me how functional medicine and chiropractic care and regenerative medicine all work together. And so now I'm going to get my certification in functional medicine.
Give me some. That's what I'm talking about. You heard it here first.
And so with State of the Body, the name, where's the state of your body?
Woo. That's the number one question that needs to be asked before we start taking any pill, any drug, any intervention. What is the current state of your body right now?
What is it?
Because so many times we want to just go from here to, you know, whether it's pain management or surgery, and there are people that need that. That's why it exists in the healthcare system. But it can't be lopsided, and it can't be that everybody needs to go there. And it can't just be a train of people just going there without even being introduced to other conservative measures that are functional or biomechanical with chiropractic or dealing with the nervous system or dealing with acupuncture or whatever it's going to be. What else are you doing before we start introducing everything where the rest of the train is going? What are the things that we've been introduced to? So you mentioned regenerative medicine, and some people may not know. I might have, you know, it's funny, I had a patient about 2 weeks ago, you know, was saying, yeah, you know, I was looking at regenerative medicine, but I wanted to go to, I don't know, somewhere in South America. Panama, Ecuador, Belize, I don't know. But, you know, I wanted to go because I heard they're doing, you know, regenerative medicine over there, and they don't do it here in the U.S. and the States. So One of the things that I talk to even medical practitioners is that they have to be educated on integrated health as well.